Welcome everyone to today's Explainer. We're doing something really empowering today. We are unlocking a comprehensive, fully science-backed toolkit to understand and actually manage menstrual cramps. And look, we're not just rehashing old wives' tales or random internet advice here. We are diving deep into real, structured medical knowledge so you can finally listen to and honestly master your own body. To kick things off, I want you to think about this massive number. 50 to 90% of women worldwide experience these cramps. That is a huge chunk of the population, and it proves one absolutely crucial thing. This exhaustion, this intense pain during that time of the month is incredibly common. It's just a biological reality. It is definitely not an overreaction, and you are not just being overly sensitive. Understanding this fact is our very first step to stop just putting up with the pain and start finding some actual solutions. So here is our roadmap for today's Explainer. First, we'll cover the nature of menstrual cramps. Then, fast relief solutions, sleep postures in yoga, nutritional tactics, and lastly, medical red flags. We're keeping it step by step. Okay, let's jump right into section 1, the nature of menstrual cramps. Because, to defeat an enemy, you first have to understand exactly how it works inside your body. Right off the bat, we've got to distinguish between two completely different types of pain. Primary cramps are your normal physiological contractions. Basically, there's no underlying disease going on there. Secondary cramps, on the other hand, those are like a blaring alarm bell from your body, trying to signal that there's an underlying pelvic issue, like endometriosis. Telling these two apart is an absolutely vital piece of the puzzle.
So what is actually happening? Well, it's a literal biological domino effect. First, the uterine lining thickens up. If there's no pregnancy, the uterus starts to contract to, clean house. But here's the catch. When these muscles contract too hard, they literally squeeze the blood vessels completely shut. This temporarily cuts off your oxygen supply. And the second that happens, your oxygen-starved tissues just go into an absolute panic and flood your system with pain-inducing chemicals.
And that brings us to the real culprit, prostaglandin. Think of this as our main villain. It's the specific chemical that directly commands your uterus to cramp up. It usually peaks right on the very first day of your cycle, or maybe just before. Simply put, the more of this chemical villain floating around in your system, the more violently the uterus is going to contract, and the more agonizing that pain becomes. Moving on to section 2, fast relief solutions. Knowing the biology is great and all, but we really need to know what to do when that intense pain hits you out of nowhere. If you're at home, you actually have some incredibly effective weapons right at your fingertips. Heat is literally your best friend here. It forces those clenched, angry muscles to relax and gets the blood flowing again. Try slapping a heat pad on your belly or lower back, and maybe pair it with a gentle clockwise massage. Also, do not underestimate the power of a really hot cup of ginger, peppermint, or cinnamon tea. It kind of acts like a warm, soothing hug for your internal organs. Now, if the pain is just too much to handle naturally, modern medicine is a fantastic tool. Over-the-counter painkillers, things like ibuprofen or paracetamol, are highly effective at cutting through the pain and dialing down that internal inflammation. But a super quick word of caution here, always strictly follow the dosage limits on the box. If you find yourself having to swallow a handful of pills every single month just to function normally, well, that's your cue that it's time to go talk to a doctor. Let's slide into section 3, sleep postures and yoga. Rest is essential, obviously, but how on earth do you get comfortable enough to sleep when your body is in total agony? When it's time for bed, curling up into a fetal position or sleeping on your side with your top legs slightly bent are top-tier strategies. Why? Because they take the tension right off your abdominal muscles and actually open up your chest so you can breathe better. On the flip side, sleeping completely flat on your stomach is a massive red flag. It puts intense, direct pressure right on your uterus. If you're a stomach sleeper and absolutely have to do it, you really need to wedge a pelvic pillow under there to keep your spine aligned and take that pressure off. During the daytime, keeping up with some gentle movement is key. Child's pose works absolute wonders for stretching out a tight, cramped lower back, and the butterfly pose beautifully opens up the pelvis. These aren't just stretching out tight muscles, by the way. These slow, deliberate movements actually trick your brain into releasing some incredibly powerful natural chemicals. And the absolute star of the show here is endorphins. You can think of endorphins as your body's own naturally produced, super safe internal morphine. When you engage in those gentle yoga stretches, your body starts manufacturing this chemical, instantly soothing your nervous system and bringing those pain levels way down, completely naturally. But hey, you really got to know your limits here. You absolutely must avoid deep abdominal twists. They're just going to compress an area that's already highly sensitive. And definitely skip the headstands or any other inversions. Flipping upside down disrupts the natural downward blood flow of your cycle, and trust me, that is the literal last thing you want to do right now. All right, Section 4, Nutritional Tactics. That old saying, "you are what you eat," is incredibly accurate when we're talking about managing menstrual cramps. Your diet can truly be a game changer. For a really solid dietary strategy, you want to load up on super hydrating veggies. Think cucumber and celery. Grab some bananas for the potassium, and definitely get some omega-3 rich salmon in there for its amazing anti-inflammatory properties. On the avoid list, you'll want to steer completely clear of salty, spicy, and greasy foods. Toss alcohol and caffeine into that mix, and you've basically got the ultimate culprits for causing painful bloating and making your inflammation so much worse. Now, here is a surprising fact that catches a ton of people totally off guard. Red meats, like beef and lamb, they actually contain prostaglandins. Remember our chemical villain from earlier? Yeah, if you sit down and eat a massive steak right in the middle of your cycle, you are literally feeding your body more of the exact same chemical that is causing your cramps in the first place. It is quite literally adding oil to the fire.
But don't panic. I have some fantastic news for the sweet tooths out there. Dark chocolate, specifically the kind with over 70% cacao, is a legitimate superfood for this time of the month. It is just packed with antioxidants, iron, and magnesium. These micronutrients work beautifully to soothe those tense, frazzled nerves and stimulate your blood circulation, which helps your body efficiently replace the blood it's currently losing.
Finally, Section 5, Medical Red Flags. This is arguably the absolute most important part of our toolkit today. We need to know exactly how to draw the line between normal everyday physiology and a serious warning sign. You have to watch out for a few very specific warning signs. If your pain is totally unbearable and completely immune to those over-the-counter painkillers, if it just drags on for more than 3 days, or if you suddenly spike a fever, see unusually large blood clots, or have severe pain that starts days or weeks before your cycle even begins, those are massive red flags. At that point, this is no longer just normal biology. This is a cry for help from your body. And this is exactly when modern medicine needs to step in. Please do not ignore these signs. Routine checkups, pelvic ultrasounds, and hormone tests are incredible tools. They let doctors look right inside and see exactly what's going on. Catching serious underlying issues like endometriosis or fibroids early on, before they can worsen and cause permanent damage, is absolutely critical. As we wrap up today's explainer, I want us to zoom out and look at the big picture. We have to ask ourselves a really serious question. Must anyone just grit their teeth, suffer in silence, and passively endure this exhausting, debilitating pain month after month? The answer is absolutely not. No way. Knowledge is your superpower here. By understanding the underlying biology, making smarter nutritional choices, using the right physical stretches, and knowing exactly when to call your doctor, you are no longer at the mercy of your cycle. With this toolkit, you are fully empowered to take the reins on your physiological well-being and protect your long-term health. So looking at your own monthly habits right now, which of these specific tools are you going to reach for first to finally reclaim your cycle? Thank you so much for joining me today, and I cannot wait to dive into our next explainer with you